Hi, this is Dr. Tam here from Vacaville, California. So today I'd like to go over why it's so important for moms who are pregnant to start getting adjusted. Not just during the pregnancy, but it's also important to get adjusted before you learn that you're about to be pregnant. The ideal time is about 1 year to 2 years before. But if you're pregnant right now, here's a few things why you need to be adjusted. Number one, the head and neck are really the epicenters and the fuse box to your whole body. Sitting right here, that's where your brain sits. Well, between the neck and this part of your body called the sacrum, which is also known as the tailbone, these two areas holds more nerve fibers and more neurons that controls contraction, that controls the delivery process, more than any other parts of the body. Now, one of the key things why when you are walking and pregnant is, it puts a lot of pressure. While you're walking and pregnant, it puts a lot of pressure on your pelvis. It puts a lot of pressure on your sacrum. And the problem is, if you are walking around with a misalignment, whether it's in the neck or whether it's in the low back, if the neck is not lined up correctly, now your lower back and your pelvis will have to compensate. Imagine if one's head was tilted one way, okay, to the side. Now, you're not going to walk around all tilted like this. You're going to walk around with your head like here and your shoulders down. Well, that causes the pelvis to bend one way as well. Now, as the baby is sitting in this area right here, it's not going to have a lot of room to move around if your pelvis isn't moving around correctly. Now, what kind of problems can that cause down the line? It can cause problems like sciatica, okay? And also, if this isn't moving correctly, pressure starts building up into the chest area and cause heartburn, all right? On top of that, there's a lot of lower back pain involved sometimes already due to the pregnancy because you're carrying an extra 20, 30 pounds just in front of here. So on top of your pelvis already being tilted forward to begin with, you also have now a pelvis that's not moving correctly. So it's not uncommon to start to develop lower back pain, sciatica, which is pain going down the legs, and then eventually it's going to make its way up and something's got to give, right? If your pelvis is locked up, your spine has to move a little bit more, and if your spine is your neck, also going to cause a lot of problems. It can cause problems like headaches. You will have increased swelling in your hands and fingertips, increased numbness. Now, that's some of the problems that it will cause during pregnancy. But as you approach labor, this is even more important. Well, that's why I also practice in our office the Webster's technique, because the Webster technique is infamous for correcting the pelvis misalignment on pregnant moms without the use of any x-rays or anything else that is invasive. The key to that is to balance the sacrum and balance the pelvis so that your pelvis and sacrum can move independently of the spine, because as you're walking, one foot goes forward, one foot goes back. If not, here's some of the things that you'll notice when your pelvis is locked up, that when you're walking, one leg will start to move a lot easier than the other. Now that side, inflammation might start to build up. And as that builds up, right across the pelvis here is a muscle called the piriformis muscle. And when that locks up in spasms, well, a big nerve that crosses that muscle is called the sciatic nerve. Now your sciatic nerve is going to fire up and you're going to start to get pain shooting down the leg all the way into your toes. That's not fun already, as if the 20 to 30 pounds you're carrying right in front of you is not enough already. During the pregnancy, when your pelvis is moving the right way, this will allow your pelvis to actually expand correctly and promote good labor expansion. See, a lot of times if the pelvis isn't moving correctly, a few things can happen. Number one, labor can stop, which means that contractions can stop, which now means more medical intervention like Pitocin, and to induce, you have to be induced to get more contraction in there. Well, the other thing that can happen is if the pelvis is not expanding, now you don't have room for the baby to actually, his head to come out this way, right here. The pelvis and the sacrum being subluxated and locked in place, that can prevent about 3 to 5 millimeters of expansion of the pelvis. And you could ask any mom, 3 to 5 millimeters might not seem much, right? But when you're having labor, 3 to 5 millimeters is huge, okay? So make sure you get your spine checked. If you're pregnant already, make sure you give our office a call or call the surrounding areas. You can even call our office if you're not from the area, so we can refer you to a specialist in your area. If you're thinking about getting pregnant, if you're within the next year or two, make sure you get your spine checked. That way you can have a much smoother pregnancy. We have moms who've had kids in here before who've never gotten adjusted, and by the second or the third pregnancy, they're like, you know what, maybe it's time for me to get checked, because they started having, whether it's lower back pain, increased tension in the lower back, starting to have numbness going down the legs. And through the Webster technique and what we've been able to do in our office, they've noticed labor process a lot easier, sometimes 2 times to 3 times as fast. We've had moms who's gone through labor that takes 20 hours the first time, and the labor the second time around is less than 4 hours. I've heard as little as 40 minutes. Dad almost not made it to the hospital. So make sure you get your spine checked, and until next time, have a great day.